يعني هاي نقاط ضرورية. يعني principle of elevator and forceps use، يعني expansion of the bony socket and removal of tooth from the socket. يعني هاي نقطتين ضرورية. شنو rotational force used for tooth with conical roots such as maxillary incisor and mandibular premolars. rotational force إذا عرفت بالتعريف from the multiple choose يعني rotational force and tractional force also ضروري are useful for final removal of the tooth from the socket. Tractional force.
دكتور بلا زحمة المايك مالك مسدود.
نعم.
احنا جروب بي.
جروب بي؟ هسه. هذا principle of elevator and forceps. First, expansion of the bony socket. Second, removal of the tooth from the socket. Rotational force used for teeth with conical roots such as a maxillary sinus and mandibular premolaris. This is a rotational force. And tractional force are useful for final removal of the tooth from the socket. And for all the tooth, move the tooth buccally, palatally, and palatally. Post extraction care socket. This is ضروري لازم تعرفون. The socket should be debrided first. Second, expanded buccolingual plate should be compressed. The bone should be palpated through the overlying flesh to check for any sharp bony projection. يعني هاي نقاط الضروري. يعني post extraction care socket should be debrided يعني تنظيف السوكت. The expanded bone buccolingually should be compressed. And the last one, any projection should be smoothed or removed. بالاختصار تكتبون بالامتحان بالمختصر ما أريد كامل. تمام. Surgical instrument يعني just use it يعني use bone bear forward for remove the bone يعني just name of the instrument and use it for what. Scalpel for handle for grasp the blade. This is blade holder for what? For grasping the blade. How many type of the blade? 3, 11, 12, 15. Periosteal elevator uses for what? For periosteal the flap. For elevation the flap. Just أي ما أعرف شرح كامل هيجي هاي. Just periosteal elevator used for elevation the flap. Mosquito for stop the bleeding. We have two types, straight and curved. For stop the bleeding and grasp the blood vessel. Just for stop the bleeding. Tissue forceps for grasping the tissue. We have two types, toothed and non-toothed. This is toothed, long and short. Long for posterior region used, short for anterior region. This is also tissue forceps, but this tissue forceps without pins. And the end is not toothed. Also for grasping the tissue. This is bone wronger. Use it for what? Use it for remove the sharp bone, spiculate bone wronger. Equal difference with bone file. Bone file use it for smoothing the bone. Bone longer just for remove the sharp area. This is bone file for smoothing the bone. Bone file. Mallet. Use it for what? Just for mallet. And chisel. Chisel used for sectioning the tooth. This is needle holder for suturing. Scissor for cutting the suture. Towel clip. Cheek retractor. Long index used for cheek retraction. This is for retraction of the cheek, and this side for retraction of the tongue. Bite block, a mouth prop for opening the mouth. This is two types of the suckers. Suction tube. This is metal and this is plastic. This is disposable and this is reused after sterilization. And just for suctioning the saliva, for suctioning the blood. And surgical suction for what? For suctioning the saliva or the blood. Curate, for curation and for cleaning the socket from the infection. أكو سؤال استفسار على هاي المحاضرة. Just name of the instrument and for what purpose use this instrument only. Local anesthesia. Terminology, pain, definition of the pain, unpleasant sensation that occur from the imminent tissue damage, analgesia, loss of the pain, anesthesia, loss of the modality of sensation of pain and touch, and difference between analgesia and anesthesia. Ideal properties of the local anesthesia and two or three نقاط لازم تعرفون. Should not be irritating to the tissue, should not be cause any permanent alteration of the nerve structure, or systemic toxicity should be low. يعني هذا 6 نقاط، أنا 3 مو أريد أكثر. Most of the local anesthesia, you have 2 criteria. Non-irritating to the tissue or completely reversible. And it must be after hours or 2 hours, the effect of the anesthesia must be removed. Anesthesia must be removed. Indication for local anesthesia just diagnostic, therapeutic, pre-operative. يعني just رؤوس نقاط أنا أريد ما أريد شرح. Contraindication for local anesthesia, history of allergy to local anesthesia, or history of allergy to other constituent of the local anesthetic solution. هاي أشياء عملية لازم بالعمل لازم تعرفون هاي أشياء، يعني مو نظري مو يجي بالامتحان، بس بالعمل لازم يعرفون هاي. needle type of the needle هذا أشياء عملية. component of the needle بس type of the local لازم تعرفون أكو amide and أكو ester. amide two of them and lidocaine لازم تعرفون اثنينات من هاي، اثنين من هنا اثنين من هنا. factor affecting the local anesthesia لازم بس تعرفون pH، وهذا هم تعرفون inflammatory process produce acidic product. The pH of the normal tissue about half, and pH of the inflamed are 5 to 6. Just رؤوس نقاط protein binding. Technique of the local anesthesia, we have block technique وinfiltration intraligament. لازم تعرفون to just name of the technique of the local anesthesia. يعني بالlower we have two technique for block. First for mental, this is block technique. Also for inferior alveolar nerve, يعني we have two techniques for blocking of the lower teeth. This is infiltration, block, infiltration, infiltration. Topical anesthesia. هاي صورة mechanism action of the local anesthesia. Normally outside of the cell sodium, inside of the sodium, inside of the cell potassium. يعني sodium from outside go inside and potassium from inside go outside. Anesthesia, what will you stop this permeability, stop this movement, يعني stop the sodium go outside, stop the sodium go in, from out to inside and stop the potassium from in to outside. This is mechanism action of the local anesthesia. Complication of the local anesthesia, needle breakage, pain at the injected site, infection, hematoma, trismus, injury of the nerve. Also this نقاط is important. يعني complication of the local anesthesia. هاي محاضرة مع complication of the local anesthesia. And this complication, you have two types of the complication. Complication occur during the surgical procedure, and complication occurs after patient go to home or occur after 3 days. This complication, in exam, I ask you, I said, what are the complications occur during the surgical procedure, or what are the complications occur after surgical procedure? After surgical procedure include trismus, just enumerate, trismus ما أريد كوز وأشغل هيماتوما ecchymosis. After that, tell you explain one of them, and as you like, explain one of them. Edema, post-extraction granuloma, painful post-extraction socket. This is very important, dry socket. This complication occur after 2 or 3 days after extraction. During this period, the blood clot disintegrated and dislodged, resulting in delay healing and necrosis of the bone surface of the socket. Etiology. Treatment of the dry socket is very important. Gently irrigating the socket with warm saline solution and placing gauze impregnated with eugenol is placed approximately every 24 hours until the pain subsides. Or, just in exam, you can state treatment of the dry socket, gently irrigating the socket and placing the gauze. Okay, enough. Dry socket is very important. Nerve injury. How many nerves we injured during the surgical procedure? Just name of the nerve. Inferior alveolar nerve, mental nerve, and lingual nerve. أكو سؤال استفسار شيء؟ This complication occurred during the surgical procedure. Fracture of the crown. Soft tissue injury. Fracture of the alveolar process. Fracture of maxillary tuberosity. Fracture of the mandible. This is fracture of the mandible. broken instrument, we have needle broken, bear broken, or surgical bear broken. This is very important. Dislocation of the temporomandibular joint. This is occurred during the surgical procedure, during the dental extraction, or during more work for the patient on the dental chair. We have two types of dislocation. Unilateral dislocation, the mandible deviated to unaffected side, and for other side. And bilateral dislocation, the mandible became forward. The management of the dislocation, you can put two fingers, thumb, on the posterior region of the mandible and other fingers around the mandible. Press downward, backward, upward, return the mandible to original position. This is what is dislocation? Dislocation means that head of the condyle, this is head condyle, head of the condyle outside of glenoid fossa. This is glenoid fossa. Head of the condyle outside of glenoid fossa. Hemorrhage also important subject. Treatment of the hemorrhage and bleeding, compressing by suturing the wound mechanically obstructed the severe end of the blood vessel. Ligation يعني by suture. Ligation يعني the grasp the end of the blood vessel by the forceps and sutured. Ligation. Electrocoagulation, hemostatic materials, and management of the bleeding by compressing, suturing, ligation, electrocoagulation, and hemostatic materials. Where is the oroantral communication occur? When the tooth go to inside the maxillary sinus or make the opening between the maxillary sinus and oral cavity. Management, excising the fistula and make the flap, buccal advancement flap, release the flap to the side of the fistula and suture it like this.
دكتور العفو، ممكن سؤال؟
نعم حبيبي.
هاي المحاضرة التريتمنت هم مطلوب لو نفس قبلها بس يعني نيوميريت
والله بس لازم تعرف هي شيء ما أعرف تريتمنت وهاي شغلات.
ماشي دكتور ماشي.
بس ما أعرف إدارة لازم هم يبلغوني بس شنو نوعية الأسئلة. إذا multiple choose شيء آخر، بس إذا شرحوا نقاط شيء أنا أجيبها شيء بسيط، ما أعرف شيء صعب هاي شغلات.
ترى هو MCQ امتحان MCQ.
نعم حبيبي.
دكتور
نعم.
قبل شوي الكومبليكيشن اللي ذكرتها بس حكيتها كأنواع، هاي بس نحفظها يعني بس النوع
يا
يعني أسامي. هاي المحاضرة اللي أخذناها قبل شوي.
complication مال اكسترا we have to type. بس أريد مثلا enumerate بس شرح واحد مطلوب. يعني أقول مثلا write 5 complications of extraction during the surgical procedure and explain one of them.
نحفظ شرح واحد. والأشياء
ما أريد كلها يعني ما أريد كل. أنا مثلا إذا 7 أنا أريد 5 وشرح واحد. تمام.
والأشياء دكتور اللي هسه ما دا تحكيها إحنا نتركها.
وهذا بس شوية يعني أنا أركز على الأشياء التي أنا حكيتها هسه.
اللي حكيت. تمام.
بس هم تعرفوا مثلا definition of the extraction و how many type of the extractions. يعني surgical extraction and normal extraction. mean that intra-alveolar extraction يعني this is normal. Trans-alveolar يعني surgical extraction. Indication of extraction under local anesthesia. Indication يعني sharp caries like this, severe periodontal disease, pulp pathology, apical pathology, orthodontic reason, prosthetic consideration. This slide is very important. Tooth in line of the fracture should be removed if it is source of the infection, tooth itself fractured, interfere with fracture reduction, interfere with healing of the fracture, and tooth in line fracture is important. And when we remove the tooth in the line fracture, in the following condition: source of the infection, tooth itself fractured, interfere with fracture reduction, interfere with healing fracture. Tooth in relation with pathological condition. Retain root. Prior to irradiation يعني radiotherapy إشعاع. Focal sepsis static. هذا بالنسبة للindication. Contraindication we have two types of local contraindication and systemic contraindication. Local contraindication, acute and uncontrolled infection, previous radiotherapy, teeth located within the area of the tumor. Teeth located in the area of the tumor, why not be extracted? Because extraction may lead to dissemination of the tumor and heal the socket and post-operative complication like bleeding post-operatively and intraoperatively. This point is very important. Teeth located within the area of the tumor should not be extracted. Systemic contraindication, severe uncontrolled metabolic disease, uncontrolled leukemia and lymphoma, severe يعني نقاط هاي نقاط بس تحفظ 3 أو 4. Severe uncontrolled hypertension, pregnancy, bleeding disorder. بس هاي أشياء لازم بالعمل يعرفون. يعني this instrument used for extraction of upper wisdom tooth. بالعمل لازم يعرف، بالنظري مو. هذا retain root used for retain root upper for lower incisors or for 6 anterior teeth for lower wisdom tooth for lower retain root
دكتور يعني هاي ما تجيبنا إياها بامتحان النظري؟
ما أجي من نظري هاي. أنا أقول يعني بصراحة هذا العملي، هذا مال عملي مو مال نظري. هاي الصور وهاي شغلات. بس لازم تعرف extraction indication contra indication. هاي نقاط الضرورة بالهاي المحاضرة. هذا مال عملي لازم هذا أبيكزو يجي. بس لازم يركزون على هاي سلايد. If the tooth badly caries or retain root contraindicated for using the turbine must be used the surgical handpiece because surgical handpiece without air not go to the soft tissue by surgical handpiece. If use the turbine, the air go to the soft tissue and lead to emphysema. Also, it is important complication of the extraction and حكيت مثلا you have to type during the surgical or after surgical.
دكتور
نعم.
بالنسبة للمحاضرة الثالثة تيبل النيرفات شلون يجي عليه السؤال؟ يعني شلون نقرأ؟
يعني مال تيبل يا محاضرة.
بس بتلك شرسية تيبل نيرفا كان كود يعني برسال لسري كودة توا.
استبعدت مشاكل مزام بقى مزام كان محاضرة استفيت عند اليوم بس بيبينو.
مقصد لك شرسية إنيرفا كان أنستيجيا.
أزان كان محاضرة بس قال بيبي مسافي طريقات بس بقى أما أنا بس بعملي قريبا مش أنا نظري زور أولية عفوا بس أمي خاتون
أمتي بلا
ولا أمتي بلا ضرورة يعني سدري بزاي مثلا inferior alveolar nerve تيكا all لما أنا من دونير بدي من داسي دونير بنبوكا يعني هيك نيرفيك بس من ناوي أمانة all mandibular teeth همو دانكاني mandible ودكا يعني same side ipsilateral side لقلتي buccal soft tissue of the premolar canine and incisors lingual nerve just lingual soft tissue of all teeth long buccal nerve buccal soft tissue of the molars and second premolar
يعني direct questions.
direct question احتياطي على direct question and sensory innervation of the all mandibular teeth or maxillary incisor and canine by which the nerve يعني I ask you give me the name of the nerve give innervation for all mandibular teeth you write inferior alveolar nerve or ask you about the lingual soft tissue of all the teeth what is the name of the nerve you said lingual nerve or ask you about the buccal soft tissue of the molar and second premolar you write long buccal nerve very easy but this table is very important
Okay, doctor, thank you. So direct questions.
a direct question but it's very important this table okay
Okay, doctor.
يعني اكو بس محاضرة مال هيستوري يعني تو محاضرة أولى وثانية يعني قلت أسويها مراجعة بس أشياء ضروري لأن هاي محاضرة بس about the pain يعني type of the pain radiated pain mild moderate throbbing pain بس هاي نقاط مهمة لهاي المحاضرة هاي محاضرتين يعني ما أدري مثلا شنو البايبسي أنواع البايبسي هاي كلها مال شغل مال باثولوجيست بالمحاضرة الأولى محاضرة أولى وثانية أكو السؤال شي توضيح أنا إذا خليت أسئلة أنا أقول لكم شو النوعية أسئلة مالتي بس حتى الآن ما بلغني الجامعة
عندك نموذج يعني مثلا مع سنوات سابقة مع
والله أنا أول سنة أنا أسوي شيء حبيبي بس أنا أسأل أصدقائي شلون هو قرار يوم الجامعة بس لا تخافوا أنا أقول لكم يعني إذا أنا خليت أسئلة شلون أنا أقول هاي نوعية أسئلة مالتي نموذج بس
يعني خلينا نقول من الأشياء اللي ركزت عليها دكتور خلينا نقول من الملازم يعني
أنا نفسي يا حبيبي بس أنا لازم أسأل الجماعة بس أنا أسئلة مالتي هيتي لو هيتي مثلا شورت أسي أور نيومريت يعني عدد هاي وتشرح شرح واحد لو شورت نوت about the following
تمام إن شاء الله دكتور يعني ما تقصر
إن شاء الله كلكم ينجحون تمام
زين دكتور إذا مثلا صارت multiple choice الأشياء الشرح اللي مثلا قلنا عليها بس إعداد شرح مثلا مالتها واحد داخل بيت شيء إنه راح يدخل الباقي كله
أنا أجيبهم شيء واضح. يعني for example أنا ركزت على مثلا tooth inline or the fracture. أنا أكتب كل هاي وأقول accept. يعني إذا صار مثلا سؤال multiple choice، بس أنا أحاول أسوي الشرح هاي شغلة أسهل. multiple choice صعب، مو سهل.
تمام دكتور.
تمام.
بس يجي لو بس يجي مثلا هذا tooth innervated by which nerve، لو يجي مثلا هذا التوث يحتاج كم انجكشن بالنسبة للبلوك بالنسبة لل
هذا كم يجي. هاي principle، يعني هذا يعني شيء ضروري لازم تعرفونه. central how can you anesthetize the central incisor upper or lower. how can you anesthetize the first premolar. يعني لازم تعرفونه. وهاي نيرفات والتكنيك of anesthesia for each nerve لازم تعرفون.
دكتور.